And to the big finish tonight, Mitt Romney's absolutely eye-popping answer on health care in this country. It is truly incredible, even by Romney standards. Here's what Romney said when he was asked, does the government have a responsibility to provide health care to the 50 million Americans in this country who don't have it today?
Well, we do provide care for people who don't have insurance. People, if someone has a heart attack, they don't sit in their apartment and die. We pick them up in an ambulance and take them to the hospital and give them care. And different states have different ways of providing for that care.
That's the most expensive way to do it.
Well, in
the emergency room.
Different states have different ways of doing that. Some provide that care through clinics. Some provide the care through emergency rooms. In my state, we found a solution that worked for my state. But I wouldn't take what we did in Massachusetts and say to Texas, you've got to take the Massachusetts model.
Of course, Romney is talking about the most inefficient and expensive way of providing health care in this country. And Romney himself knows this. Here he is in 2010.
Do you believe in universal coverage?
Oh, sure. Look, it doesn't make a lot of sense for us to have millions and millions of people who have no health insurance and yet who can go to the emergency room and get entirely free care for which they have no responsibility, particularly if they're people who have sufficient means to pay their own way. And so we said, look, we got an idea. Let's take all the money we've been spending to give out free care, paying hospitals that give out free care, and let's use those same dollars to help people who can't afford it buy insurance, some portion of their insurance premium.
Obviously, in that interview, Romney said the exact opposite of what he said in the 60 Minutes interview. One more point. There is no such thing as free care. Americans without health insurance can go bankrupt from an emergency room visit or two. Let's go a little further back in Romney time, in the Romney time machine to 2007.
When they show up at the hospital, they get care. They get free care paid for by you and me.
Right.
If that's not a form of socialism, I don't know what is. If people can afford to buy insurance, if they can afford to buy insurance, or if they can pay their own way, then they either buy that insurance or pay their own way, but they no longer look to government to hand out free care. And that, in my opinion, is ultimate conservatism. That's why the Heritage Foundation worked with us and was at the celebration of the signing.
Oh, brother. In Romney's book, No Apology, he said he had an epiphany about how to redirect emergency room money to people who needed health insurance. That's part of the reason Romney Care actually worked. Now Mitt Romney is saying, just leave it up to the emergency rooms, which he called socialism back in 2007. Mitt Romney, you know what he needs to do? He needs to debate himself. We deserve it. I'm joined tonight by Nicole Lamoureux. She is the executive director of the National Association of Free Clinics. Nicole, great to have you with us again tonight. I know you're out there doing great work on the behalf of the people. Great to have you with us. What is your response to Mitt Romney saying that we care for people without insurance because they just go get it at the emergency room?
Well, quite frankly, I was flabbergasted. To think that the answer is to go to the emergency room, I think that's ludicrous. The reason it's called an emergency room is it's used for emergencies. Sending the uninsured to an emergency room is absolutely positively backwards. We want the uninsured to go to doctors to get the primary and preventative care that they need so that they can be productive members of society. Sending them to the emergency room when their diseases have exploded is just sentencing them to death.
Romney also mentioned free clinics. I mean, can you even begin to address the burden of the uninsured in this country through free clinics?
Well, I can give you a no. I mean, let's be honest. Free and charitable clinics across the country are doing the best that we can. But let's take this example. We're in Texas right now, the state that he acknowledged. He said he would never do what happened in Massachusetts and give it to Texas. We are going to be doing a free clinic on Saturday. We already have 900 people registered to come and get care at a convention center. Obviously, there is a dramatic need here in Texas and across the country. Our clinics are doing the work that they do with little to no federal or state support, but we rely on volunteers and donations. It's not our job to handle this entire problem of the uninsured. It just can't be done by us.
Romney's plan in Massachusetts has worked, but he doesn't think it should be applied to other states like Texas. And you're in Texas. What about that?
I find it absolutely amazing. As I said, we have 900 people already registered for this free clinic. We need more doctors and nurses to come and help us because we know we could see up to 2,000 people in one day. 2,000 uninsured individuals who have nowhere else to go to get the care that they need. To say that there is not a problem in Texas or this country is just a mistake.
Nicole Lamoureux, thank you for joining us tonight. Keep up the great work.